Hello, my name is Linda Okafor, and in this week 7 journal, we dealt with cultivating cultural competence in psychiatric mental health practice. So, in a recent encounter with a patient from a culturally diverse background, I realized I lack cultural competence in understanding and respecting certain cultural norms and beliefs. The patient, hailing from a Hispanic cultural background, expressed symptoms of anxiety and depression, but his manifestations were interpreted differently due to his cultural context. I failed to recognize the cultural nuances influencing his expression of distress, leading to a gap in our therapeutic alliance and potentially hindering the effectiveness of my care. This patient was in prison when his brother passed away. Coming home to the same house and seeing his late brother's son brought back some emotions he thought he had overcome. He resorted to prayers, alcohol, drugs, and sex to distract himself. Upon recognizing my lack of cultural competence, I took immediate steps to rectify the situation and ensure the provision of optimal care. First, I acknowledged the oversight of the patient, expressing openness to understanding his cultural perspective better. I engaged in active listening, allowing the patient to narrate his experiences and elucidate the cultural factors influencing his mental health journey. Through genuine curiosity and empathy, I sought to bridge the gap and establish a deeper connection with the patient. Moreover, I consulted with a colleague who possessed a better understanding of the patient's cultural background, seeking insight and guidance on how to integrate cultural sensitivity to my practice. To address my deficiency in cultural competence, I undertook various measures aimed at enhancing my nursing skill and knowledge. I engaged in continuous education and training programs focused on cultural competence in psychiatric mental health care. These initiatives included workshops, seminars, and online courses designed to deepen my understanding of diverse cultural perspectives and their implications for mental health treatment. Furthermore, I actively sought our literature and research articles addressing cultural consideration in psychiatric practices, incorporating evidence-based strategies to my clinical approach. Reflective practice became a cornerstone of my professional development, prompting me to critically evaluate my interaction with a culturally diverse patient and identifying areas of improvement. As I transition into the role of psychiatric mental health nurse practitioner, I am acutely aware of the imperative to continually learn and improve in cultural competence, recognizing that cultural competence is not a static skill but a dynamic process. I commit to ongoing self-assessment and reflection to identify biases, assumptions, and gaps in my cultural understanding. To ensure I remain abreast of my best practices and emerging trends in cultural competency, I plan to engage in interdisciplinary collaboration, seeking insight from colleagues across various cultural backgrounds and disciplines. Moreover, I will actively seek feedback from patients and colleagues regarding the cultural responsiveness of my care, utilizing their perspectives as catalysts to growth and refinement. Additionally, I aspire to cultivate a culturally sensitive practice environment characterized by inclusivity, respect, and empathy. These involve integrating cultural competence into every facet of my clinical practice, from initial assessment to treatment planning and therapeutic intervention. By fostering a culture of continuous learning and humility, I endeavor to uphold the highest standard of care and serve as an advocate for the diverse needs of all clients. Thank you.